Check your state and facility policy to make sure you are permitted to perform this procedure. Before you begin, perform hand hygiene and follow any other instructions provided in the preparation section of this program. When preparing to assist the patient to the commode, be sure to put on gloves.
Do you need your robe today? Are you cold?
No.
With the commode next to the bed, remove or open its cover or lid. While the patient is sitting on the side of the bed, offer to help him put on his robe and put on non-skid slippers.
And we need to use a gait belt on you just for security, so you don't fall.
Using a transfer belt, help the patient to the commode.
All right, Mr. Rogers, I'm going to ask you to push off with both of your arms.
For details on this technique, see the video skill, Transferring from a Bed to a Wheelchair with a Transfer Belt.
1, 2, 3. Okay. All right, gently lower yourself down. You got both the handles? There you go.
Then cover the patient with a bath blanket. Place the toilet tissue and signal light where he can reach them.
And this is for your use, sir.
Okay.
Ask the patient to signal when he is
I'm gonna
finished.
place the call light here, and if you would call me when you're done, and I will come and help you.
Okay.
If needed for safety, stay with him. Otherwise, provide as much privacy as possible. After removing your gloves, perform hand hygiene. When the patient signals that he is finished, perform hand hygiene again and put on gloves.
Mr. Rogers, these are for you to use.
If needed, help the patient with perineal hygiene as shown in the video skills about performing perineal care. Assist patient with hand hygiene.
Okay, Mr. Rogers, we'll get you back into bed.
Then help the patient return to bed.
Okay, we're going to do the reverse. You hold on to the handles, and I'm going to help lift you on the count of 3. Ready? 1, 2, and 3. Take your slippers off.
Remove the transfer belt and take off his robe and slippers. Cover the container with a towel or lid. Remove it and take it to the bathroom to be emptied. Look for abnormalities such as blood in the urine or an unusual odor or color. If you notice any, tell the charge nurse before emptying the container. If the patient's intake and output are being monitored, measure the amount of his urine. Empty, clean, and disinfect the container according to facility policy, replacing the lid. Replace the container in the commode and clean the commode according to facility policy. As part of your follow-up care, return the commode and other supplies to their proper place. If needed, document the output and make sure the patient is comfortable and the call light is within the patient's
I
reach.
want you to call if you have any kind of problem or question.
Perform hand hygiene and report completion of the procedure and your observations to the charge nurse. See the follow-up section of this program for detailed
Is there
information.
anything else? Are you comfortable now?